Hello, everyone, and welcome to another episode of the Cycle Podcast. I have Genika with us here today. She is from Fort Worth, Texas. We were just briefly chatting about how it's nice and lovely there and a little bit cold here in Detroit. Thank you so much for coming on. We really appreciate it. How are you doing today?
Doing actually great today. It's been a long journey, but I'm doing great today.
Well, we look forward to getting into your journey. And like I said, very grateful for you for sharing your journey here on the Cycle Podcast. But before we jump into all the endo stuff, why don't you just tell us anything and everything about you? Is there anything you want to share? Give us a little sense of who you are.
Of course. My name is Genika Reed, and I'm from Fort Worth, Texas, like you said. I am married with 2 children, and I currently work with a health science center in Fort Worth as well, UNT Health Science Center, and I'm the senior program manager there, working with college students in the pharmacy area. And like I said, I began my journey with endometriosis back in 2014, which is originally when it started, but I wasn't aware that I had it.
Yep. And we'll dive into that. So 2014 is really when you started to discover this, but I want to back up to earlier childhood. Do you remember how old you were when you started your period?
I was 13.
And do you remember, were you in pain, or was there anything that kind of just was like something seems off when you were that age?
No, I was never in pain. My cycles was always short. It would last at least 3 to 4 days. I never had any horrible menstrual cramps. I had light cramps, and then my cycle would go away after 4 days. I had a normal cycle.
And so was it like that through middle school, high school, as you got out of high school? So you just have this normal, everything's, what I think is normal. I don't know. I that sounds pretty normal, but you just went on with your life and everything. So then something must have happened. What happened?
Yes, I had normal cycles all the way up to my adulthood. So it was back in 2014 is when I started having light pain, but not too much heavy pains. Like within my pelvic area.
Yeah.
So that's when my gynecologist discovered that I had fibroids. So she suggested the only way to remove my fibroid was to have a partial hysterectomy. So I had that back in 2014.
Okay. So you had a partial in 2014 and
using Da Vinci robotic surgery.
And how old are your children, or where do your what age are your children now? And then
my children are grown.
Okay.
I have a 21-year-old and a 25-year-old. So
this didn't come on after you had children or anything like that.
No, everything was normal. I had normal births.
Later. Yeah. Okay.
Yeah.
Sometimes
this was years later.
Because sometimes I like to ask that, because I've talked to some people that after they right after they had children, they started to have this pain. So this is just years later for you.
Yes.
Okay. So you just think, I have some fibroids, I've been having this extra pain, so you have a partial hysterectomy.
Right. She said if I didn't have the surgery, they were going to continuously grow. So I was like, okay, let's get them removed. I didn't plan on having any more children. So
sure.
It's okay to have a partial hysterectomy. So I did that.
Okay.
So within almost 2 years later to the day, I started having chronic constipation pains, chronic pelvic pains.
Yeah.
A pelvic area and buttock area that felt like hemorrhoids. And I thought they were hemorrhoids because my family went on a long vacation to Florida back in 2015, and we drove. So I was like, okay, I've been sitting for a long period of time. Maybe they're just hemorrhoids. Yeah. Started treating it as such. But come to find out, no, it wasn't hemorrhoids. So I was going back and forth with myself, diagnosing myself.
Sure.
After Google, trying to see, okay, what is causing this pain? Then I started having vaginal bleeding. So I was like, why am I having bleeding? I had a partial hysterectomy.
Yeah.
Not be bleeding.
Yeah.
And I started going to the ER, and she told me I need to go to my primary care doctor, because then they diagnosed me as having a urinary tract infection.
Of course.
She told me to go to my primary care doctor. So I did that. And then my primary care doctor then referred me to a gastroenterologist, because she was saying, I'm not sure what it is, but you may need to go do additional testing.
Right.
It was in my buttock area.
Right. What did it feel? Was it like a shooting pain? Like what was, or was it just like a constant?
It was a constant, like something was just stabbing me in my pelvic area.
Yeah.
This lasted for 3 to 4 days, like I was having a cycle every month.
Now, did this started in, you said in 2016. So
no, this started in 2015.
Oh, so the year after
almost like
1 year.
Yeah, about a year and a half.
Interesting. How did you feel from 2014 to 2015?
Oh, perfectly fine.
And no bleeding.
Fine. No bleeding, no pain.
Okay. So now you're getting referred to all of these doctors, and I'm sure you're getting every test under the sun.
Oh, yes. And they was like, we can't figure it out. You're fine. So my gastroenterologist pretty much diagnosed me as having chronic constipation. So she started treating it as such. And so once I kept going back to her every month, because it was happening every month, she was like, well, I'm not sure what it is. I don't know what else to do. When she told me that, I literally broke down in tears.
Yeah.
I felt like I was going to have to deal with this pain for the rest of my life. I told my husband I didn't know what else to do. I felt broken. I just felt defeated at the bottom.
Yeah.
And yes, I felt defeated, pretty much.
Was the pain cyclical? So it was cyclical. So was it getting really bad 3 or 4 days?
It was getting worse. Yes. It kept getting worse as time went on.
Yeah.
And so when I sat in my car, I was on my way home, and it's like God spoke to me. Go back to your gynecologist. And I was like, I had an epiphany. I was like, duh. She was the one that performed the partial hysterectomy. Why not?
Sure. At this
point, I went back to her.
Were you thinking it was like something maybe from the hysterectomy? Were you thinking it was like related?
No.
You just had your intuition. God told you.
I was like, I wasn't even thinking about this partial hysterectomy.
Okay.
I don't know what else. It has to be something else. I'm just not sure. Just let me go back to my gynecologist. They'll figure it out. And so I went back to my gynecologist. They performed a biopsy, a pelvic exam. And she said she did find a mass that was in my pelvic area. And it was bleeding. It was like a vaginal cuff that was bleeding. And she was like, well, I'm not sure why it's bleeding or what's causing it, so we're going to do a biopsy. And so she clipped a little piece of it. And so they performed a biopsy. And it came back, I can't remember the word she used, but she did say that they did find some endometriosis that was latched onto some of my ovaries. Not my ovaries, but my uterus. Mm-hmm. No, my ovaries. I'm sorry, because my uterus was removed during that partial hysterectomy. And she said she was going to have to refer me to another specialist because it was deep within my pelvic areas that a lot of it she couldn't reach. And so I was referred to a oncologist.
Okay.
And that's when she had to perform another test to see how deep it was. And it was so deep within my pelvic area, she was telling me that I had to have the surgery of a patient that has colon cancer. So she ran a test to make sure I didn't have colon cancer first. Yeah. But then when it came back negative, she said, yes, you do have to have that surgery that a person has is if they had colon cancer.
At this point, like, was anyone saying endometriosis? Did you go Google it yet? Or you're still just on this path of like, what is going on?
My gynecologist told me it was endometriosis. And I was like, well, what is that? I've never heard of it.
Yeah.
So she told me what it was. She was pretty much saying it was when the tissue that normally lies within the uterus lies outside of the uterus. I was like, well, I don't have a uterus. So how is it on the uterus?
Yeah.
Because of the partial hysterectomy during the robotic surgery, some of the endometriosis cells must have latched on to my incision. She said, I'm not sure why all of a sudden you're now experiencing the pain. I'm just one of those unlucky ones in rare cases where it happens.
Interesting.
That's why I'm just now experiencing so much pain because it latched on to my incision and I had scar tissue from that surgery.
Interesting. Yeah. And it's tissue similar to the tissue that's in the uterus, just so for anyone who's listening. But yeah, that's very interesting. Okay. So now you're seeing this oncologist. I mean, how are you feeling? Are you scared because you're seeing this now oncologist?
Yes. I'm completely scared, confused.
Yeah.
Looking all online, and I just felt alone. I felt alone within my journey because I was mixed diagnosed. Why did she say I've had chronic constipation? Now I'm hearing that I have endometriosis.
Yeah, for
so
sure.
I was upset. I was frustrated. I was confused. I felt alone. And I was like, okay, it has to be something that can heal this.
Yeah.
Okay, we get rid of it now.
Yeah.
So I'm looking up, she gave me pamphlets on endometriosis. She told me to go to a website, Endometriosis Association. So I went there, got information about that. And then I went on to do my own research about it. Yeah. And I found that there was a lot of women that had it. And then I found out even actress Tia Mowry has it. And I was like, okay, so now I'm getting an understanding of what it is.
Yeah.
So along that journey in 2016, I decided to have the full hysterectomy, what my oncologist said I needed to have. So I did that. And during that surgery, they had to make a midline incision on my abdomen, remove my ovaries, clipped a piece of my colon, put it back together, and a piece of my vagina, remove my bladder to get underneath that area to remove endometriosis, and then placed it all back once the mass was fully mobilized. So I went through all of that, which was a 5.5-hour surgery. So everything sewn back up.
Yeah, I'm so sorry.
Hospital within 2 weeks, I believe. So I'm at home thinking I'm healing. Okay, I'm finally getting into this space where I can heal. I can try to move forward, get no medication and things like that. Within, I would say, a month after my surgery, that's when I started having all kind of complications.
Oh, I'm so sorry.
I had to get an ostomy bag because I was having bowel movements through my. Is it okay for me to get graphic?
Yes, absolutely. Trust me, I've heard it all. Please get. You know what though? Please get graphic because there's such a stigma and people are so afraid to talk about this. It might be happening to them.
Right. It
might be happening to them. So a month later, so you had a bowel resection, but they just put your intestine back together.
Yes.
Okay.
Yes. So I'm trying to heal. And she was saying, well, once you get a bowel movement, then I was going to be released and stuff from the hospital. So that's when I had passed gas, but I didn't actually have a bowel movement. And so I had to be put on the ostomy bag because I was having feces come from my vagina.
Oh my goodness.
And I knew it wasn't normal. And when I went to the bathroom the first time it happened, I remember the day because my husband came home showing me his new car because while I was in hospital, he got into a car accident.
Oh my
story. Yeah. I went through.
That was a rough patch.
And so I had took this medication because I was going in to have another surgery to get the ileostomy bag. Yeah. And so they put me on this medication to clean out my system pretty much.
Right, because isn't that extremely dangerous?
Yes.
Yeah. And how did they rewire something? Like, I don't understand how that happened. Yeah. Were you so scared when that moment?
Yes, I was very scared. It's like my gastroenterologist didn't want to take blame for it. She was just pretty much saying, this should have been done with your oncologist. You should have had a bag put on your stomach pretty much after your surgery when you had the full hysterectomy. No one told me there's a possibility you're going to be making bowel movements at your vagina.
No. Absolutely not. That is not supposed to happen.
I felt the lowest of low.
I'm so sorry.
Oh my gosh. I felt so ashamed because my sister and my niece was here visiting. And then I'm trying to run back into the house from seeing my husband's new car. And then as soon as I try to run in the house, that's when all my feces came out on the floor. crying, I'm bawling. I'm like, oh my God, I'm sorry. And my sister's trying to help me in the shower to clean up. My husband had to go run and give me some Depends because it just kept flowing out for almost, I said about an hour.
Oh my goodness. Were you in pain as well? Was it?
Yeah. My stomach was cramping and hurting.
Yes, of course. And this is only a month after surgery.
This is only a month.
Yeah. You're already still in pain because you're recovering.
Yes.
Did you go to the ER?
No, I didn't go to the ER, but I had called my doctor. She said, well, you just have to wait until your surgery the next day, which was my surgery to have the bag put on.
Got it.
And so she said, you're just pretty much cleaning it out. She said, I'm sorry that it had to happen that way, but you're just cleaning out your system so you can have the surgery.
Oh my gosh.
Yeah. So that once that was done, I fully pretty much cleaned out my system. I just took a shower and went to bed. I was and just ashamed.
Mortified.
Yes.
Yeah, of course. And no one ever warned you that that could even happen.
No. I'm like, wasn't I told this?
Right. And why didn't you put the bag on when you did this?
After I had that pretty much long surgery, a 5 surgery, and you move so many organs in my body like that.
Yeah, that's a hard, I've had a bowel resection as well. That is a very difficult recovery. It is a long, I don't think people, and I don't want to scare anyone who's listening, but it is not easy.
No, not at all. And then once I did that and had the surgery to get that put on, of course, they show you how to take care of it.
Sure.
It was embarrassing. I had to go back to work pretty much 6 weeks or 8 weeks after.
Yeah.
My best to hide it. A lot of people didn't know I even had the bag except for my family and close friends. No one had the bag on. So I hid it very well.
Were you scared about the bag, or did you feel better actually because you knew it was there, you knew everything was healing, and you knew you could take care of it? You weren't going to have like an accident.
I was kind of scared about the bag when I first had it on because I was like, I really take care of myself. But they did offer home health care, but I was like, no, that can help me with this. And plus my mom was in the medical field, my sister into the medical field, so they could help me as well. So that wasn't the case about taking care of it. I was just like it for myself, because you get into that mode where I don't want anybody's help. I just want to figure this out on my own because you already feel the shame.
Yep. There is, and I shame and guilt. I understand. Yes. And we shouldn't feel that. This isn't our fault.
Exactly.
I know. Yeah. Okay. So how was that surgery?
To have the bag on? That surgery, it pretty much lasted for about 2.5 hours. Okay. So that surgery wasn't bad. Okay. Of course, I don't remember anything. Of course,
you're out of it. But still, I mean, it's another surgery after you just had surgery.
Yes. And so I had the bag on, went back to work after 8 weeks, I believe, and trying to get back into my normal routine with my bag. And then I can't remember how long after, but it probably wasn't too long because everything within this time frame, my journey happened within a year.
Which is it's a lot. I mean, that's a lot.
So I'm trying to get back into my routine. I'm going back to work, trying to complete this leadership program that I was in. And so one day I just had this unbearable pain in my side. And I felt like I just couldn't walk. I'm like, what is that? And so
what now? Like,
yes, I'm like, what is that? Am I doing something wrong with the bag? What's going on?
Yeah.
And so I called my doctor and she said, you need to get to the emergency room ASAP. No, before that, I had went to the doctor and she said, come on in, let's see what's going on. So she did an ultrasound to see what was going on. And she said, for some reason, you're retaining fluid. I'm like, what? She said, I'm gonna need you to go to the emergency room ASAP so they can get you a room. So I called my sister, she took me to the emergency room. And I'm waiting in there for hours, already in pain. It took them 2.5 hours to see me. I'm sitting there in pain, waiting on some pain medicine that I was told I was going to be given as soon as I got there. Never got it. So I'm crying calling my mom. She came out because I was in the same hospital where she worked. So she came down, I'm crying, and she said, well, let's go see what's going on. And then they got me into a room and got me on some pain medication.
What was the pain like? Like, was it like a shooting down your leg kind of pain, like a nerve pain, or was it just?
No, this pain was like somebody just had their fist just sitting in my stomach on the side. I was like, oh, what is it?
Yeah. Yeah.
And then I could barely move.
How, before that happened too, with the ileostomy bag and like all that, how were you eating? Were you losing weight? Like, were you feeling nauseous?
Oh, I lost a lot of weight. I got to even before my high school weight.
Yeah.
I got to, because normally I weighed around 135, 140 to 118. Even 115 was my lowest.
Yeah.
A lot of weight. I was trying to eat. They had me on this strict diet. What was it? A low fiber diet. Things. I'm like, what am I supposed to eat?
Right. Yeah.
Not feeling good. This was my lowest.
Yeah. I'm so sorry. Okay. So I'm sorry. You're back at the ER. Your mom finally gets them to give you some medication. You have fluid. What happened?
They tell me that I had, my right kidney was enlarged. Of course, they're not going to they can't tell me how that happened. They say, oh, you're just one of the unlucky ones. It has happened to you again. I'm like, seriously?
Are you like at some point, like, is this all like,
exactly.
Were you like, is this all related at this point? Like, how all of a sudden were you this like healthy, everything, no pain?
It never made sense to me, and no doctor to this day can explain it to me.
They were treating everything so separately.
Yes. They just keep saying it's very rare and you're unlucky.
Oh my.
Yeah, I have my right kidney is enlarged, so that's what happened. And I had fluid build up because of scar tissue, I was told. So I had to get a stent put in my right kidney.
Yeah.
Had that for about, I'll say about 3 months, 6 months.
Okay.
And so I had to have surgery. I had to have another surgery to get that put in.
Oh my gosh. Was it during that stay in the hospital, or did you get to go home and then have to come?
Oh no, that was during, I had to have it like ASAP.
ASAP, yeah.
So that was during that stay during the hospital. So here I am with a stent in my kidney, still the bag. And now they're gonna send me home with a catheter because I'm not able to go to the restroom. So
now you have 2 bags.
Yeah. So I'm taking care of a catheter with my bag, going home with this, and having to take all of that on my own because my husband had to go to work. My son was in high school then. He was a senior year in high school. My daughter had to go she was in college, going to work as well. And so from the time my daughter did help me at home with my catheter, but I mean, come on, that's embarrassing.
Yeah, 100%. Yeah.
Yes. Here I am with a poop bag and a pee-pee bag.
Oh my goodness.
Yeah. So of course, I'm healing with all that, trying to heal in the first place. And then they're trying to get my bladder back on track. So I'm having to go to physical therapy for that, trying to get it back on track. And then a couple of months later, I have a surgery to have the stent taken out.
Yeah. And the bag, when the stent came out, then you could get rid of the catheter.
The stent came out. I had the ileostomy bag in for about six months.
6 months. Okay. Yeah.
And so I think it's before I had the bag removed is when she said, well, you still have the hole that's between your, I'm trying to make sure I have it right, because I developed what they call a rectal vaginal fistula, where, of course, where the feces was coming out of my vagina. So she said, we have to build a wall between your vagina and your, what was it? I believe it's the vagina and the buttock area.
Yeah.
And
that would make sense. I don't know the medical term for it.
I just don't want to say the wrong terms here because I want to understand what it was.
Yeah.
So they had to get a muscle removed from my inner left thigh to build that wall between my vagina and the buttock area. So no more feces coming in between.
Sure.
And so I had to have that surgery.
Oh my goodness.
That surgery was about, I'll say about 2.5 to 3 hour surgery. And
Wow.
it was painful. I think that surgery was worse than the full hysterectomy.
Because the muscle.
Yeah, because I had to even try to go to the restroom because this time they pulled out my catheter. So I had to try to go to the restroom with a hurt leg that had incisions going all the way down, all the way up to my vagina area.
Oh my goodness.
So imagine trying to go to the restroom on the toilet with that incision. It was terrible. I said, I can't do this. So they had to put the catheter back in. So I stayed on the catheter for probably about a month.
Okay. Well, that healed.
Yeah, while my thigh had healed. And then after that, I say about a month later, that's when I got the catheter taken out. And I was trying to get back on. Of course, my ileostomy bag was removed before my inner thigh surgery.
Right.
And so when they took the catheter out, is when they discovered that I was still having bladder issues. I wasn't emptying all the way.
Yeah.
So then I was going to see a urologist. And that was back in 2016, towards the end of 2016. So I've been seeing a urologist from that point on to now. I'm still on antibiotics trying to heal my bladder because I'm not emptying all the way. Getting better.
Yeah. I've heard of other people that have endometriosis that has happened to as well, where they struggle to empty their entire bladder. And then I think, again, I'm not a doctor, but I think that's why sometimes it can back up into the kidney.
Exactly. Yeah. So that is pretty much where I am today. I no longer have the bag. I no longer have to use the catheter, but I am on antibiotics for my bladder. For your bladder.
And how, since all of that happened, obviously I'm sure it took some time for you to recover.
Yes.
And now it's 2020, 2016, it's been a few years, but how did you unpack all that mentally afterwards? I'm sure it was very difficult because it was just so much happened to you in such a short period of time.
Yes. So during my journey, I started using a journal because I had to keep up with my appointments, the specialists and doctors I was seeing, what they were diagnosing me with, the medications I was taking, the surgeries I was having. So I started making a journal. And then from that journal, I turned that into my book. I wrote a book that's titled Scars with an Untold Story. So I self-published that on Amazon. It took me a while to do that though, because I had to get over my emotions of what I was dealing with.
Absolutely.
Low self-esteem. I didn't look at my body the same.
Yeah.
I was very ashamed of what I went through.
Yeah.
And my husband had to help me with that because he did tell me, you're beautiful inside and out. It doesn't matter what you've been through. Just know you're strong and your story will help someone else.
Incredibly strong. Incredibly strong.
Thank you.
What was the name of the book again?
It's titled Scars with an Untold Story.
I'll link it in the show notes for everyone who's listening.
Yes, and I self-published that on Amazon just to get my testimony out there to what I dealt with, just to hope to raise an awareness, of course, with endometriosis. And if everyone knows that there is no cure.
Yeah, and I bet that was actually very healing to write.
Oh, yes, that was very healing for me. And another thing I did, what I was advised by the lady that her name is Mary Lou Bell. She's the founder of Endometriosis Association. She invited people to write a letter to the doctor that misdiagnosed you. Not a hate letter or angry letter like that. Just a letter just to tell them, how you felt during your journey and what you went through. So my letter was to my gastroenterologist who misdiagnosed me as having chronic constipation. I just pretty much told her how I felt, what they did to me when she told me that there was nothing else she could do, how that made me feel.
Yeah.
I advised her to please not ever tell another woman that you don't know. If you don't know, just educate them on what endometriosis is and also educate yourself if you don't know.
Yes.
So that was self-healing for me.
I think that's such great advice. And I've heard some other people say that they've sent a book to an endometriosis book. I like the idea of writing a letter, because not only does it help you, release some of that, but hopefully the doctor reads it. And then the next patient who comes in, they don't tell them the same thing.
Exactly.
They could say, I don't know about endometriosis, but you should find
someone, the resources,
someone who does.
Or let me direct you into that direction where you can find the resources.
Yes, absolutely.
And surprisingly, 2 to 3 weeks later, the doctor called me and she apologized. She said, I'm so sorry. I didn't know that's what you had. From the symptoms you were describing, I felt that it was chronic constipation. She said, I'm sorry that I wasn't educated on it, but I will educate myself, and I will also educate women as they come into my office. That right there was, to me, so self-healing and so educating for me and for her.
Yes, because you did that, and now if she sees 50 patients that have those same simple, symptoms, and IBS is a common misdiagnosis for people with endo. So if she sees them, then you've already maybe helped so many more people.
Exactly.
By doing that.
Yes. And that is my ultimate purpose, is to share my testimony, my journey.
Yeah.
To women to understand the symptoms of endometriosis.
Yes.
Go seek help about it. Even if you get to a doctor that says, well, I don't know what it is, go to another doctor and get second opinions. Keep getting answers until you feel that you're getting the necessary information for you and your health. Yeah,
I tell people all the time, trust your gut, because it really will tell you if this doctor's right or doctor's wrong. Exactly. If someone tells you you're not sick, but you still don't feel right, know your body better than anybody else. You know something is wrong.
Right.
When you reflect back, and I know you said when you were younger, you didn't, very mild periods. Did you ever have like back pain or any type of other symptoms, or none at all?
No, that's the funny part. I had no symptoms at all until I started having those pelvic pains.
Yeah. I just think that that's good to share though, too, because I think there's other people that are in your situation that maybe they didn't have those classic early symptoms.
Right. You know? I didn't have the heavy bleeding that some people say they experience. I didn't have any of that.
Right. Or the low back pain or cramps or anything. Right. 4-day period. That's like a dream.
Yeah. I was in heaven. I was like, 3 days? Okay. Why not?
Yeah, that was like some of my friends growing up, and they're like, oh, this is so easy. What are you complaining about? I'm like, what are you talking about? I don't understand. Wow.
Yeah.
Well, I'm so grateful you're feeling good now. I mean, how's no pain, feeling good, everything?
No pain.
Obviously, you still have the bladder stuff going on.
Oh yeah, besides the bladder issues, it's just the downside of the menopause symptoms. Yeah. Hot flashes. Oh my gosh. I tell people all the time, it's the devil.
Putting your head in the freezer.
Yes. I'm like, man, when they come, there's no end to it. It's just like you just have to go through it. It lasts for about 3 to 5 minutes and it's done.
It's interesting because I have them at night. Sometimes I get them at night, and it will wake me out of a sleep. Where you are sitting up and you are just drenched, and I'm just like,
I have to throw the cover off.
Oh yeah. My
husband calls me his personal little heater.
He's like, wait, don't throw the cover off. You're warm.
Like, stay over here.
You're like, no, get away from me. I'm hot.
Back up.
Well, thank you so much for sharing. Is there anything else you want to add? I know you said tips, keep seeing doctors until you're listened to. I love the letter idea. I think that is such a wonderful idea to help others, and help the doctor know that they they made a mistake. And but yeah, if there's anything else you want to add before we wrap up for anyone who's listening.
Well, I just want to say thank you so much for allowing me to share my testimony. I just hope my story inspires other women to continue to share their stories so that women can know what endometriosis is, even men, so they can know their wives, mothers, sisters, what symptoms they're having, so they can even educate themselves as well. And to have a support group, even if it's just a couple of people around in your neighborhood, your family, your friends, even social media. Find some Facebook pages or some groups that can help you out with your symptoms and to share your stories. So just to get information off your head. Even people just want to share their stories, even the simple stories that they have of what they're going through. Because I know women need that. I know I needed that, but I didn't have it.
Yeah. And I think that that's such great advice. It took me years and years to open up. And I would tell people I was having back surgery. I wouldn't even be honest about the surgery I was having because I was embarrassed. I was embarrassed, you know, and the more I opened up and the more I talked about it. And again, if you're not comfortable doing that, you don't have to, but find that 1 or 2 or 3 people you can really open up to. But as soon as I did, I felt more at ease because I felt empowered.
Yes.
I felt empowered because I was being very honest about what was really going on behind closed doors.
Exactly. Even when I wrote my book, my mom and my sisters, they were like, well, we didn't even know you went through all. We didn't know that's how you were feeling and what you went through. We knew it, but we wasn't in that detail. So
yeah. It's, you know, I think it's also very hard for people to understand unless they've been in it. It's, you know, it's a lot to go through, and, you know, your supporters are so great and they can see it from the outside, but it's, you know, all those surgeries, it's a lot of time and effort and being embarrassed and feeling guilty, and you don't need to do that.
Exactly. It takes a mental and physical toll on your body,
but it does.
Know that there is resources out there and people that will stand behind you 100%. There's help out there. Even though there's not a cure, there is help.
Yes, there's help, and there's great communities, like you said, on Facebook and chat boards, and there are wonderful communities that are very supportful. Well, thank you so much. And I will link your book because I'm going to check it out. Absolutely.
Thank you.
So thank you so much for coming on.
Thank you so much. I appreciate it. You have a great day and Merry Christmas.
Merry Christmas. Happy New Year.